Good afternoon or evening, folks. Guess it's afternoon. Today's first topic is what's driving the 2026 Medicare shakeup. We're going to go through those today for A. So please join me for A's presentation. What's driving the 2026 Medicare shakeup? Here we go. The upcoming overhaul of Medicare plans for 2026 marks one of the most significant shifts in recent years, and it's not just a matter of fewer choices. It's a recalibration of how insurers, the federal government, and beneficiaries interact within the Medicare ecosystem. According to the Wall Street Journal, more than 1 million people will be directly affected, with many forced to switch plans due to cancellations, benefit cuts, or rising just a minute, folks. I'll get some costs. This information is being fueled by a convergence of factors. Insurers or insure strategy shifts. Many insurance companies are pulling back from certain markets or streamlining their offerings. This means fewer Medicare Advantage plans will be available, and those that remain may offer less generous supplemental benefits like dental, vision, or fitness programs. Federal policy and drug pricing reform. The Inflation Reduction Act, drug pricing provisions are beginning to reshape Medicare Part D. The federal government is negotiating prices for a select group of high cost drugs, which will lower cost for some, but also pressure insurers to adjust their plan structures and formulas. CMS pilot programs and payment adjustments. The Centers for Medicare Medicaid Services, CMS, is testing new payment models and care delivery frameworks that incentivize value-based care. These pilots are influencing how insurers design their plans and which benefits they prioritize. key changes beneficiaries must understand. The ripple effects of these shifts will be felt definitely depending on your location, health needs, and current coverage. Here's what's changing: plan cancellations and redesigns. If you're enrolled in a Medicare Advantage plan, there's a real chance your plan won't exist in 2026 or will look very different. You'll need to actively choose a new plan during the annual enrollment period. Premium increases and benefit reductions. Some plans are raising monthly premiums while while simultaneously cutting back on extras. This means beneficiaries must weigh cost against coverage more carefully than ever. Drug costs relief for some. Medicare's negotiated prices will apply to a handful of expensive drugs, potentially saving thousands for those who rely on them. However, these savings are drug specific and won't won't benefit everyone equally. Part D, cost sharing changes. The out of pocket maximum for prescription drugs is being lowered, and catastrophic coverage thresholds are shifting. This could reduce financial strain for those with high drug costs, but may also lead to changes in plan premiums and coverage tiers. What you should do during open enrollment. This year's open enrollment, October 15th through December 7th, 2025, is not business as usual. Here's how to prepare. Don't assume your plan is safe. Even if your current plan worked well in 2025, it may be gone or altered in 2026. Review your annual notice of coverage, the ANOC, and compare alternatives early. Scrutinize drug coverage. Use Medicare's Plan Finder tool to check whether your prescriptions are covered and at what cost. Pay attention to tier changes, prior authorization requirements, and pharmacy networks. Evaluate total cost, not just premiums. Look at deductibles. Co-pays, coinsurance, and out-of-pocket premiums. A low premium plan might cost more overall if it covers fewer services or has higher drug costs. Consider provider networks. If you if you if you have preferred doctors or specialists, you make sure they're still in network. Some plans are narrowing their provider list to control costs. After you enroll, stay vigilant. Even after you've selected a plan, the landscape may continue to shift. Watch for late announcements. Insurers sometimes make last minute changes to provider networks or benefit structures. Stay informed via CMS updates and insurer communications. Monitor plan finder updates. CMS may tweak its online tools or correct errors during the enrollment period. Recheck your selections before the deadline. Prepare for 2026 transitions. If your new plan includes different pharmacy or provider networks, start planning now to avoid disruptions in care or medication access come January. This moment is more than a bureaucratic reshuffle. It's a reflection of deeper tensions in the Medicare system, balancing affordability, access, and sustainability for you and others. Working on culturally responsive aging innovations. These changes also underscore the importance of helping marginalized communities navigate complex systems with, with clarity and supports. Okay, guys, so that is A for you. I will be back on with B shortly. Give me a bit for B, please, and I'll be back on with you for that. For now, Gator Wellness, take care, folks.